back to Today's Woman, a trusted source for cutting edge medical information and holistic solutions for Black women's health. I'm Dr. Rahman, and today we're going to be talking about rapamycin. Let's talk about the use of rapamycin in the past. In the past, this was an immunosuppressant drug given to renal transplant patients. It was well tolerated, and then it was noted that given at a lower dose, this particular medication had an anti aging effect when given to animals. It eventually received FDA approval as a medication for persons with certain types of cancer. Recently, there was a study that's been looking at the potential of using rapamycin in women's health care, focusing on aging of the ovaries. Just to backtrack, just a little biology and physiology. A woman is born with all the eggs she will ever have. Once she starts to menstruate, each cycle, she will start to mature a group of egg follicles. Only one egg will become the dominant follicle, will be released from the dominant follicle into the fallopian tube. The other eggs will get absorbed and be lost. So, over time, when a woman is having a menstrual cycle, each cycle she's losing a certain number of eggs. By the time she gets into her late 40s and 50s, she's essentially depleted her eggs. Her hormone levels go down, and she will eventually experience what we call menopause. However, knowing that this medication is considered an anti aging medication, the question was, if we gave this medication to women, would it help to slow down the aging of her ovaries? Meaning that with each cycle, would she lose a fewer number of eggs? And if that happened, that could be revolutionary in that it will allow a woman to potentially delay childbearing until after she's finished school or she's fast tracked her career and then be able to have children. There's also the possibility that with this medication, if it can work as an anti aging medication on the ovaries, it may delay or potentially postpone menopause because a woman doesn't completely deplete herself of the eggs, which is seen typically. Rampamycin is not a new drug. It's been available since 1999, and to date, it's been considered a safe drug when given to renal transplant patients, when given to cancer patients. There have been minimal adverse effects noted. In addition, often participants not only have tolerated the drug well, but they've reported that they've experienced better health, enhanced memory, increased energy levels, and improved quality of their skin and hair. Given all of this, a recent study is being done at Columbia University looking at the use of rapamycin in women in their 30s and 40s, checking to see if when it's given to them over a period of time, can they demonstrate that it slows down ovarian aging? If that is in fact the case, then the implications of potential use are huge for this drug. Obviously, more study has to be done. The initial study will only use a small group of women. They'll be observed over a relatively short period of time. If the results of the initial preliminary studies are positive, then larger clinical trials will be needed. This may be a revolutionary change in how we approach subfertility, aging, ovarian aging in women. This is Dr. Rahman, and I invite you to stay tuned as we use this platform to provide additional information. We want to create a community of well-informed women who are ready to take control of their health and never be subjected to unethical studies. Until the next time, stay healthy, stay informed. On a personal note, I should say that I would not recommend anyone try this or try to attempt to obtain this medication online. We don't know long term effects. We don't know if it can truly reverse or slow down menopause. Proceed with caution. I will stay informed. I will keep you informed.